Welcome to 2022. The new year is a great time to reflect on the past year and think about how you will set yourself up for success in work, life, at the practice, in your PCN, and in any other area in which you operate in the coming year in 2022. Gandhi and I have tried all sorts of techniques over the years to help with productivity and success and achieving goals. And we will, in this episode of eGPlearning, be reflecting on some of those techniques and talking about how we are going to try and set ourselves up for success in 2022. So let's get started. Hi, Gandhi. Welcome.
Thank you, Andy. And how are we doing in this new year in terms of things treating you and stuff?
Yeah, not too bad. I think I've still got a bit of a hangover, not from alcohol, but just from the general effects of 2022 pandemic, work, NHS directives, and all of that. But yeah, being positive, looking forward to 2022 and looking forward to our chat about how we're going to set ourselves up for success in the coming year.
Absolutely. So we thought we'd kick off the new year with kind of like this whole new year, new you style of podcast, just to help everybody out there think about, well, you maybe want to make some changes, looking at refreshing things, particularly with all the challenges we faced over the past year. And yeah, we thought we'd go through some of the things that we've looked at in the past and also currently doing to try and make our lives a bit more productive. And hopefully that'll help all of you to do that, as well as, covering probably a little bit about what we got planned in the next year coming up in terms of eGPlearning and various other things that are happening for all of you. So where are we getting started, Andy?
Well, so what people can expect from this episode is a look at sort of general review, goal setting and productivity systems from our perspective as GPs and primary care network clinical directors. And we're going to start right at the top at sort of helicopter global level and think about just how we review things, priorities. We're going to start moving down towards goal setting, breaking those goals down. We're going to talk about some of the concepts around actually maybe it's not about focusing on goals, it's about focusing on the process. So we're going to look at habits and routines, and then we're going to get down to the principle level and looking at the sorts of principles that can help people be productive and successful. And as we do that, we're going to talk about, I think, examples from our own lives, both work and personal lives, and about how we're applying some of these and maybe not all of them in the coming year. So yeah, so I think we were going to start with sort of just thinking about how we review things or, review last year. So do you do any sort of review of what's happened in the previous year, Gandhi?
So one of the things that helps me review what I've done in the past year is actually every Christmas/New Year time, I tend to have to do my tax return. So that's normally a good point for me to reflect on the previous years. Now, yes, that's not the last actual year. It's the year before that because of the way the financial stuff works. But the reason why I do that is it lets me realize what's actually changed financially for me. And that often helps me do a kind of stock check of what I need to be thinking about doing in the next year in terms of trying to make that more sensible for me. And actually, was that time I spent to have effectiveness useful or not? And if not, what changes do I need to make in terms of making that more effective for me in the following year? Does that make sense at all?
Gandhi, that does make sense. That's instantly jumped me to the concept of linking habits. I'm just going to jump there because I go through the same process and I do my tax return, and I also I do a spreadsheet looking at where are my savings and things like that. What's happening with those, because that's part of the information I look at for the tax return. So I do a little bit of a financial review, and actually I've this year added another tab for kind of personal goals to the spreadsheet that I use. And the principle there is that if there's something that you do consistently at about the right periodicity, right, with the right intervals to be useful, you can link like a new habit in. So I'm sort of trying to link together my review of more kind of personal and professional goals together with my tax return and financial review. So it's really interesting that you do something similar.
And I guess the other one that, people often talk about work goals and other kind of goals. So it's kind of fortuitous for me, but my appraisal is actually around about August time. So I've got that financial personal life kind of one with my tax return in, December, January time. And then I've got that work-based personal kind of one with my appraisal, which is around about August time. So it's about 6 months apart. So it kind of complements it. So for me, it's worked out really well. I appreciate not everybody's going to be in that same situation though, in terms of where their appraisal and stuff sits. So yeah,
and I must admit, I'm actually not that great at reviewing the last year. So that's something I'm I want to do this year, but I've not done it yet. And actually, I've skipped to sort of planning the next year before I've even reviewed. I love this sort of stuff, Gandhi. So I'm not going to pan to my left, but I've got a whiteboard, and that's sort of got my goals and things from last year on, which I have had a look at and reviewed. But some people talk about much better kind of systematic ways of reviewing the past year, and people talk about actually taking out your calendar and just sort of looking through, and you can do things like think about, you know, what was actually impactful, what was a waste of time. You can categorize the information. I've never quite got in the habit of doing that sort of analysis, actually, and I tend to just take a bit more of a broad brushstroke review of the year. Do you do anything systematic, Andy?
So I think I like to try and have a stock take of what I've been trying to do, and I'm always keen to try and stick more personal stuff in there. I'm pretty good at figuring out the whole work side and the productivity side, but one of the things that, like most people, when you're ridiculously busy, you can sometimes neglect some of the more personal goals that you want to do. So trying to introduce more of that in is the part I often need to focus on. I don't necessarily sit there with my calendar, although one of the things that has made a massive change to my life over the past particularly year and a half is using calendar blocking to try and make sure I've got time available. So making sure I'm not double booked, but more importantly, blocking out particular sections of my time so I can't book something else into there has been a real, basically it's been game changing for me in terms of productivity and stuff. So now I've got a specific section of my calendar that is blocked out for doing eGPlearning stuff, whereas previously I wouldn't have done that. And actually that's one of the reasons why I'm probably quite productive in a lot of the stuff I do now, because I know I'm not going to stick something else into that time.
Yeah, make an appointment with yourself to do the things that are important to you. That's a really good principle, isn't it? And I've become a lot better at using my calendar in the past 18, 24 months since becoming a clinical director. Actually, I did used to use it, but because you become so busy and you have so many meetings and appointments with people, it sort of forces you to use the calendar. And, you know, I had a few upsets early on where I've been double booked and so forth. And
yes, I know.
So yes, it's happened with some of your meetings, Gandhi. So reviews. So I guess it's something that we do, but in a more kind of relaxed, sort of ad hoc way. I guess by the sound of things, and it might be nice to try a more detailed exercise. But I'm a forward-focused person, so I like looking at what's coming up. So I guess the next thing we'll talk about is just that kind of priority setting, that kind of value level. I think it's easy to rush into setting specific goals and targets, and you've got to make sure you've got the right goals and targets. So a lot of people will advocate just thinking about what's important in life to make sure that you guide it. I mean, I used to just think about goals and targets, and I used to end up with a lot of kind of professional work related goals, and then wonder why I'm perhaps not making progress in personal and family or fitness and kind of other areas. And it was because I didn't set goals in those areas, because I didn't have a process around that. So I try and be more inclusive to other areas of my life now. Do you have any process around priority setting or value setting, Andy?
Personal life, similar to yourself, I'm probably not as good at doing it, and I think that's something that I'm trying to change for this year in particular. So I've set up a couple of personal goals in terms of what I'd like to do. So some of the classic ones, like trying to do more regular exercise and stuff, and how I've implemented those is going to be something we talk about a bit later on. But also just in terms of how I engage with things with work. So making sure I'm not doing particular bad habits that I know had an impact on my quality of life. Putting changes in place to stop those from happening. So it's not necessarily about taking on new habits, but it's also about stopping bad habits as well. That's an interesting part that I think many people actually struggle with. So it's identifying the good as well as the bad, and how you're going to change those different things.
Yeah, I tried something last year, and I'm looking over to my left because that's where that's where the grid is that I'm looking at. And I thought, well, my life's only
it's a
so
shame
big.
Andy won't show us this, because I've seen this grid multiple times. It's quite diverse, isn't it?
There might be passwords on my whiteboard and things that you shouldn't see.
Yeah, probably better he doesn't, but yeah.
So I think my life's only so big. So there's a square, and then I've tried to sort of represent within the square different aspects of life that I ought to focus on, and like the size of the boxes within the square, sort of relative to like how important they are. And then you within the boxes you put what's in there. It ends up looking a real a real mess, and
Mhm.
the size of the box in terms of how important it is to you doesn't always reflect how much is in there. But it's a good way. So the sort of things I've got on there, I've got career and work is half, and then there's sort of personal life on the other side. And then I've got in work, I have a few roles. So I've got the practice, the primary care network, the federation that I work with, and eGPlearning as well. And then on the personal side, I've got health, self, personal development, and essential administration is on there. That's what I decided last year. And then it's actually, there's a big version of it that takes up almost the whole wall. And it's, my idea was to put like the to-do lists within. And it's really interesting how the professional ones that I seem to be devoting a lot more energy to than my personal goals. But I think the exercise was useful, and I am going to do something similar. I'm going to do something similar this year. Last year was the first year I'd done it in that way. And I'm going to do it again this year, and I'm going to try and make sure I've got specific goals in each of those areas.
Okay.
Yeah.
So I'm going to suggest to any of our viewers and listeners, if you want to have an idea of what Andy's box plot kind of looks like in terms of his life goals and stuff, let us know in the comments. Either stick a thumbs up emoji, or if you're listening to us, then send us a message and stuff. And what we'll do is that in one of the future episodes, we will put up a blank version of it so you can see, not the one with all of his passwords and everything else on there, but you'll be able to have a look at it from there and see what we think of the stuff, because I think it'd actually be quite useful for people to see. But yeah, let's see if we can get some motivation for Andy to do that for us.
Yeah, I'm up for that. Yeah, do you break things down like that, Gandhi? Because I'd be interested to know what your boxes are or would be.
So I don't graphically do it or any kind of structure in that kind of sense. I do try and block out time, as I mentioned. So I've got particular blocks in my Google Calendar, which is what I use for automating my life and stuff. So I've got things in there that I stick to try and make it more sensible and capable. So, things like gym time, I block into my calendar. Things like, like I said, eGPlearning in particular, I put into there. I've actually got when I'm meant to be at work blocked in as well, even though I don't put blocks in my tasks. So I do separate stuff when I'm actually at work. But just in terms of when I know, and more importantly, so my wife knows what I'm doing as well, which is the other part. So, it saves a lot of stress in terms of us having to coordinate ourselves because we just share our calendars. So, I can see if I've got to go to a party for the kids, like I do later on this afternoon, I know I can't do anything this afternoon because I'm taking my son to a party, just simple things like that. But that shared mechanism allows it to work really well. What would be awesome is if, the N365 version we have allows to work with other tools. Unfortunately, it doesn't, which is one of the biggest problems I've got. But I know what a lot of people are now starting to do is to use their Outlook calendar as their main calendar because of that issue that we have with N365 security and stuff. Whereas I still haven't made that jump over to using Outlook as my calendar rather than Google. But that's a personal preference.
I'm in Outlook now. It works.
It
works well.
So Andy's converted to the Outlook ecosystem, I know. But interestingly, Andy, we've had 3 people asking for having a look at it at some point. So we've got 1 like and we've got 2 comments saying that they would love to see it. So
okay, well, yeah. I will have to clean it up a little bit, but yeah, and I do think it's a good. I do think it's a good tip, and yeah, you heard it here first. I'm sure somebody else has invented it as well, separate to me, but came up with it.
We're going to talk about some of the other things that are around that can help you with that in a few seconds. Probably now. Is that a good segue, do you think, Andy?
Well, yeah, whichever way you want to go. We've got goals next, moving down.
Yeah.
Okay, we'll stick to the program. Yeah, so that's kind of priority setting, I guess. And then in terms of goal setting, so a lot of people who talk about setting up for success, or the typical way to think about it is to think in terms of setting goals, and make them smart and so forth. And that's very classical productivity thinking. I know what I like to do now. I've got my box. Is I like to set goals and make sure I'm setting not all professional goals or not all health goals. That maybe might have some financial milestones or goals that I need, or social kind of goals, to try and make sure I spread goals across the areas of my life that I have said are valuable to me, and make sure I set some goals in each of the boxes. So that's the process I'm going through at the moment. And then also an idea I'm toying with this year, Gandhi, is sort of plotting out the year on my whiteboard, and then kind of just sort of seeing where those kind of quarter 1, quarter 2, 3, 4, or kind of monthly goals, where they sit, and put those next to big events that are happening within the year as well, like my appraisal or other things. I'm sounding like I'm very overstructured, I think, here, Gandhi. Do you have any sort of systems with regards to goal settings? What's your thoughts on goals?
So I think for me, what I tend to do is a similar process. I look at the year. I've got a calendar that, basically I stick up with the months in rather than specific dates, and sticking the key things that happen in those months. So for example, obviously family wise, big events that we know are happening, birthdays, that kind of stuff, just so I've got my eye on important things. And then also religious stuff I then put into there, because that has a huge impact on my availability in terms of there's particular things in the religious calendar that mean that I can't do certain other things at those times. So making sure they're in, so I don't plan for other stuff around those times. So classic example is obviously me and Andy do some really cool things for eGPlearning, like the S1 conference and other kind of conferences in particular. So making sure they're not booked at similar times where I know I'm not going to have as much available time, like there's a religious thing that happens in summer at this time. Making sure they don't clash is really important to me, because otherwise that's not going to work. It's going to cause me more stress. So identifying those things, and then, like you say, other work stuff like appraisal, trainee inductions, because that's a big thing that I do control in terms of the practice. And other stuff that comes into play. So trying to structure it all around that. And then I put the other things that we do, like with eGPlearning, or big things I've got planned, like, courses, conferences, that kind of stuff, around those. So then it just means it's less stressful for me. That's the main thing. And that's what I'm trying to avoid, is, less stress, because otherwise it makes it more painful.
Yeah, that's good. I'm beginning to understand your system, actually. And it all starts to slot together quite nicely, doesn't it? If you think about sort of values, set your goals, set your goals across your values to make sure you've got good coverage, and then set your goals throughout the year, so you're not rushing to do everything at once, causing you stress. That planning can help alleviate some of the stress, so that's good. I've got again, it's another thing which I think I've invented, but I'm sure someone else has invented it as well. It's a concept called the composite goal. Okay, so this is something that I thought I'd tried last year. So for me last year, I said, right, I want to do at least one timed 10K run by the end of the year. And the idea there was that actually, so that's a specific goal, but actually other priorities I got were around becoming personally fit. I had a bit of a health problem at the beginning of last year, so I wanted to try and regain some cardiovascular sort of capacity and so forth, and help with that recovery. I wanted to get my nutrition right, and all of these things. And actually, I thought, if you set a kind of smart goal in a clever way, it can actually make sure that if you hit that goal, you're hitting a number of other goals which contribute to it and keep you on track. And part of planning to hit that goal is about having the right habits. You've got to run a few times a week, for example, if you're going to be able to run a decent time 10K by the end of the year. So I'd call that a composite goal, and maybe setting a few of those is a good idea. And I'm going to try and do more time. I want to do a time 10K run once a quarter this year coming up, and try and improve my times. And I think that'll help me continue to make gains in physical fitness, which is something I'm looking forward to. And I want to try and think about some other composite goals that I might be able to set in other areas of life, maybe some professional ones. A lot of goals are composite, but being deliberate about it, I think, can be helpful. Any thoughts on that? Do you either directly or inadvertently use that?
So I do it from a slightly different perspective. So some people may have heard of Warren Buffett. So he's an American philanthropist / investor. I think he's like the third or fourth richest person in the USA or something like that. And he's known for particularly investments and how to make them work effectively. And loads of people follow him for that reason. That's not why I'm aware of him, though, because one of the things he mentioned was that in life you should have basically 3 main goals. Okay. At any given time, you should have 3 key goals, and everything else you should do in life should align in some way to one of those 3 goals. And if it doesn't, then it's probably not an effective use of your time, because it's not what you're trying to achieve in your life. So,
I love it.
Yeah. So
carry on.
Taking Andy's example was, I want to do a timed run. So everything he does has to align in some ways to that or one of the other 2 goals he's got in his life. And they could be personal, they can be professional, whatever. So, for example, the way I've used it, last year, one of my goals was to get eGPlearning to 5,000 subscribers. Yeah. So when it came to eGPlearning stuff, if it wasn't helping the subscriber count, then I was kind of thinking, why do I need to do this? And if it's not helping with that, then I shouldn't be doing it, because that was the goal, and we smashed it. So people may not know this, but over Christmas and New Year's, we hit 8,000 subscribers. So we absolutely smashed that goal. So in my perspective, it's kind of worked doing it that way. I probably need to now think about what the next goal is, which is what I'll be doing in the next few weeks and stuff. But I think, having 3 main goals and everything that you're then doing, asking that question, how does this activity I'm now being asked to do fit into one of those 3 goals? That's a really powerful question. I find that's really useful.
That's a really powerful concept, Gandhi. I'm enjoying this conversation.
I wish I come up with it, but Warren Buffett is the guy who came up with it. So yeah.
So Gandhi, just to bring some of this into the kind of professional practice primary care network realm, it might be worth just showing the target document that we have at the practice, because some of this thinking has actually gone into the creation of this. Let me just make this a little bit bigger. So this is from last April. We've actually I couldn't find the version that we'd used in our team meeting actually at the end of the year, but some of this kind of thinking has gone into the development of our practice objectives. That's my practice there. So at the start of last year, we thought about what we want to do and what our kind of areas that we wanted to improve were. And then we set a few carefully selected goals, almost composite goals, really, within those areas. So we wanted to look at growing the list size. The patient experience was important to us. It's important to patients as well. Improving access is part of that. One of our big roles is preventing illness, and it's important that we have good quality. Care quality is important to us, and it's important to our patients. So we said those are our main areas, and that aligns with the priorities of other partners like CQC as well, for example. And then we thought we can't set loads and loads of headline goals. These are the goals we share with the whole staff, the whole team, that we all work together on, and we try and link a bonus payment actually to these goals as well. And then within it, so if we just take patient experience, for example, we thought actually improving the friends and family score and trying to improve NHS choices ratings would be a good area. And they're a bit composite, because actually in improving your friends and family feedback, you've actually got to make sure that the experience of booking an appointment, receiving treatment, how people feel treated by staff, the quality of the care and the minimization of mistakes and adverse events, all of these things kind of play into that. So it's quite a good composite goal to set. So I just thought I'd sort of share that really. And somebody said they love tables in the comments. So this is a table at heart. So I just thought I'd share that really, and just show how some of these principles can be applied within your partnership meetings, your practice meetings, your primary care network meetings, to apply some of this thinking and set some goals and priorities for the coming year. So that was that. That's coming up later. We can stop sharing the screen probably. So the next thing we'd put on our plan, Gandhi, was to talk about this tension actually between goals and habits and routines. Well, not tension, but there used to be a lot of focus in personal productivity quarters on goals, or at least that's all I used to kind of see or read about or hear when you went to a seminar about these things. And increasingly people are talking about actually it's more important about habits and routines and the process, and that maybe you should have less emphasis on goals and more emphasis on the process that gets you there. That you shouldn't want to run a 10K run. You should want to be a person who runs regularly, eats well and sleeps well, and actually acts like a person who runs a 10K. Maybe it's a bit nuanced, and maybe there's a lot of overlap. They're very similar, but any thoughts for you on this, Gandhi?
I think this is the part where a lot of people get stuck sometimes. So they get focused potentially on the opposite, which is the process rather than on the goal. So, you come across a guru or somebody else who talks about how you can change things, and you spend so much time looking at the process of how to change, you're not actually doing the change. Does that make sense?
Yes. I think I've heard productivity porn, I think, something is a concept I've come across. That people get addicted to learning about productivity and they don't do it.
Exactly. There's so many different processes and structures and things you can do, and different ways you can approach it and all that kind of stuff. And some people get so stuck into, it's like the whole to-do list. There's so many different apps out there to help you create your to-do list that so many people get so bogged down with the process of integrating the to-do list into what they do that they don't actually end up doing anything as a result of it, which is the part of the problem, I think. So it's important that you need to have a system that helps you work with what you're trying to do, but isn't so ground shaking and breaking, in the sense that then you get so focused on adapting and integrating that into what you want to do, they end up doing nothing. And it's no different to, over the past few years, I've helped quite a few people do things like start their own podcasts or YouTube channels and that kind of stuff. And often the first thing I tell most of them to do is just get started, because they spend so time trying to get the right background, the right equipment, the right stuff to get started that they still haven't got started, And it's the same principle, but when it comes to productivity, I've had loads of people saying, "Oh, I want to look at, this system that is going to, I've read the book and it says about doing this and doing that." And I'll come back to them about a month later and they still haven't started doing anything. They're still trying to integrate that system into their life. And I'm like, well, what's the point in the first place? Just make a small change and work from there. That's often far more effective.
Yeah, no, absolutely. I'd agree. I used to spend a lot of time looking for the perfect to-do list app and things like that. And then actually, pen and paper's pretty good. So I've been using pen and paper for a while. I've actually just started using the tasks, part of the N365 suite, that sits alongside your email. Just because that it tends to be kind of, it follows you everywhere, and it's kind of everywhere where you're logged into your email, you can switch across and look at tasks. So I'm starting to use that, but it's a very, very simple implementation of to-do lists. And you can just get on with using it. So yeah, sometimes you just need to get on with it, don't you? And not procrastinate around getting the right process. So yeah. So again, in 2021, I read Atomic Habits. Everybody, it's one of those books that everybody was talking about, and it was on a lot of YouTube channels and podcasts, getting a lot of attention. And that was really good. And that did sort of talk about this difference between goals and habits. And they were suggesting, James Clear, I think is the author, was suggesting that people sometimes focus a bit too much on the goals and don't focus so much on habits. And he was saying that habits are actually really, really powerful and powerful ways to get you to where you want to be, and also where you don't want to be, because you can have good habits and you can have bad habits. So this was a really useful book for me, actually. Should I just talk to some of the main principles in the book, because I think they might be helpful?
Go for it. Yeah.
And you've probably got your opinions on this as well. So when you get to the nub of the book, it really talks about how you form the power of habits. So in fact, have we got the incremental change chart? Maybe it's worth bringing this up. So talks about, so habits are doing like a small thing every day that moves you in the right direction a little bit every single day. So, if you have good habits, then the idea is that actually the effects of those habits compound. So the effect of going for a jog 3 times a week or something, over time that keeps and makes you more and more healthy. Okay, so it's a small thing, but done consistently moves you in the right direction. He also talks about bad habits. So, if you smoke cigarettes, for example, every day that you smoke a cigarette doesn't make you that much worse in terms of health, but that's a bad habit, and the effects of that compound over time. And the difference after many years of someone who's had a number of good habits and implemented them well and had bad habits can actually be really huge, even though the daily effect of those habits is small. So that he talks about the power of having good or bad habits. So then he talks about how to form good habits and break bad habits. It's a really, really good book. I think a lot of people have broken it down better than us. I know Ali Abdul, for example, popular YouTuber, has done a really good breakdown of the book. But talk about, so you need to identify what habits you want to have or you want to get rid of. He says you need to do something, say, for about 20 to 30 days in a row to either break a habit or make a habit stick. So never skip twice in a row as well. So if you don't do it one day, that's fine, but just make sure you do it the next day, or that you keep that next appointment. Otherwise, you start forming a new bad habit of not doing your good habit. And then he talks about, actually, you might have some examples of this, Gandhi. How to make a good habit stick. And he talks about making it obvious. So make the visibility of that habit high. So put your running shoes by the door, get your kit ready the night before, just make it difficult to ignore, make it attractive. So you can kind of reward yourself for it. Try and make it enjoyable in some way. Buy some nice running shoes, so you can enjoy it, use it. Make it easy to do. So I think that's more about getting things ready the night before and things like that, just kind of make it easy to do, reduce the friction points. If you need to write your journal every morning, just make sure it's, by your bed, just make it easy for yourself to do it. So you don't have to rummage for it. And also try and make it satisfying. So you can link it together with, rewarding activities afterwards when you're done. Also talked about linking habits. So if you, for example, do your taxes every year and you want to review something else, then link it with that. There'll be lots of other examples. So that was really powerful. Have you used any of those techniques, Gandhi?
So definitely the preparation one. So when I was training for the half marathon, that's what I had to do in order to make sure I went out and did my runs. Because when the morning came, that concept of staying in a nice warm bed was so much better than going out for a run in the cold and stuff. But the thing that always used to be the block for me is if I didn't have my stuff ready quickly, it was so easy for me to just think, oh, I can't be bothered. So I'd have everything ready, like you say. So get the, my shorts and my top out. So it's literally right next to my bed, jump out of bed, and get them on. As soon as they were on, that's it. I'm done. That was the barrier for me. And what I used to do is kept it next to my phone, which was on the other side of the room. So when my alarm went off, I had to go get to my phone. And since my clothing was next to my phone, it was right there for me to put it on so I could do it there and then. Yeah. And then the linking part, again, to go into that more detail, I had, after that, I had problems with my Achilles. I've probably mentioned a few times on the podcast and stuff. So I'm like most people, I'm really bad at doing my physiotherapy, So what my physio came up with a really good idea is, well, what's an activity you do every single day? Well, every morning I brush my teeth. Right. So we created an exercise that meant I could do it whilst I was brushing my teeth. And what I did is stuck on my toothbrush, just a little Post-it note that I keep there that I stick on when I finish. And it just is a reminder, do your exercises. So when I reach for my toothbrush, got the reminder, right, so as I'm brushing my teeth, 2 minutes, that's all I needed to do every single day was my quick physio exercises whilst I was brushing my teeth. And when I started doing that, the gain impact I had in terms of the strength of my Achilles and everything else was so much more significant because I was doing it and I was remembering to do it, and it was linked with something that I knew I was going to do every single day.
That's good. Very powerful. Yeah. I put your tablets by your toothbrush. That's what I always say to people on contraceptive pill. You can put it by your toothbrush, you'll take it. So I think friend of the podcast over at You Are Not a Frog does really good work on productivity. And
Dr. Rachel Morris, Andy forgot to mention the name, but but definitely some really powerful podcasts. So the two I like that's related to this is making helpful habits stick. So really talking about trying to make them regular part of your routine and how to do that. And then the other one that we talked about, so it's a similar concept to Atomic Habits, but this was from about a year or so back. And so this was Tiny Habits by Dr. Catherine Hickman and with Rachel Morris and stuff. And definitely that's the one that helped me realize about linking stuff in more personal things. So I remember that one definitely changed a lot of the things I was doing when I listened to it from, like I said, I think it was about a year or so back it came out and things. So definitely have a listen to those.
Cool. So the next thing I was wanting to talk to you about, Gandhi, was routines. So a few years ago, it was all about goals and SMART goals. And then people talked a lot about routines and, the morning routine of, billionaires, and things like that. There's a lot of talk on routines. And I do sense it's kind of moved on to sort of habits a little bit now in terms of where people are talking. But do you have any daily routines that you think are the key to your ongoing success or at least lack of failure so far?
I think there's some processes I put in. They are kind of become routines as a result of the processes. I don't know. It feeds into the principles that we're going to talk about next. But so I'll probably save them for there. But I think one thing that I think a lot of people will probably come one side or the other side on when we relate to general practice is going to be the clothing routine. Okay. So what I mean by that, obviously with COVID, many people have started using scrubs at work. in place of normal clothing. And actually, I quite like it because I no longer have to think about what I'm going to wear in the morning when I go to work, because I just wear normal clothes, whatever I've got. And then when I get to work, I change into my scrubs. And that has been really, in some ways, liberating for me, because I used to spend a few minutes every morning figuring out what am I going to wear, or does that shirt go with that tie? You know, I tried to mix up combinations because I didn't want to wear the same things all the time and stuff, and still look professional. But actually going into work with scrubs now is just so much easier. And I just wear something that's comfortable, go to work, get changed again, come home, and I'm done. Yeah. I don't know what you feel about that, Andy.
Yeah, you know, something, I was just thinking, I think the tie is dead now. I think the handshake will probably come back, but I think COVID has killed the necktie. And we'll all look back and think, well, why did I used to wear a tie? Why did we tie like a colourful piece of fabric around our neck? It's gone, I think. Just, you heard it here first or second, the tie's dead. Yeah, I think... I think routines are things. Often we do them without thinking about it as well. You know, it's about people might clear their path lab, results, every morning or every evening before they go. And actually, routines can be quite useful, protective, and if you establish the right routines, that can set you up really well. They're a bit like habits as well, aren't they?
Yeah.
Oh, having some comments about
I'm laughing is because of the comments, and I love this. So I'm going to share this series from VJ Could. So thank you for the comments, VJ. Scrubs all the way. I'll never going back to wearing a shirt. Easy to wash, and they require no ironing to boot. It's just one less thing to worry about from Lizzie Steer. So I think, sounds like I've got some definite agreement in terms of the whole scrubs concept for long-term for primary care. I know there's definitely some other people who feel, no, they want their clothing back. They want their nice, professional looking attire and stuff. Fine, whatever suits your boat and stuff. But for me, yeah, scrubs all the way.
Yeah, tell me, do you think the tie's coming back? Just in the comments, see if people agree with that one. So that was.
With that. Do you think the tie's coming back in healthcare?
It's gone everywhere.
The business world is slightly different, to be honest.
I think it's gone from most places, I reckon. But definitely from healthcare.
Yeah. Okay. So if you think the tie has gone from healthcare, then put a tie emoji in the chat or a thumbs up. And if you think it's going to come back, put a thumbs down. And we'll see if anybody does that. That's true. I think I used to just tuck it in the top bit of my shirt when I used to wear one in the end. So it was sort of, redundant really in many ways. Yeah.
So we were also going to talk about some principles, because there are some kind of handy principles, rules of thumb that can really help with your thinking around productivity. And I don't think these are routines or habits. These are truly something else. They're important principles. So we jotted a few down. I think they've come up from time to time in our general conversations. But the first one is Parkinson's law. I know you're a fan of Parkinson's law, Gandhi.
Mm-hmm.
Tell me about Parkinson's law.
Okay, so Parkinson's law is the principle that simply any time you allot to something, the task will expand to fill up that time. So I probably butchered the whole wording of it, to be honest, and I tend to do that a lot with the principles, but I reflect them in what I remember, and that's the way I remember it. So if you have an hour-long meeting, your meeting will take an hour long. Yeah, probably go over a little bit as well, but it's unlikely to be less than that because you've allotted an hour long. So no matter what task you've got, you're going to fill up that time. And I guarantee there's going to be people out there thinking, yeah, definitely. That's what happens and stuff. And it's the principle similar with with consultations. If you have a 10-minute consultation, chances are it's going to take at the very least the 10 minutes. It's not going to be less than that because you've allotted that amount of time to it. So the question then comes, have you allotted the right amount of time to that particular task? Because if you haven't, you're probably wasting time. And that's the key part to look at. So I know we've got a little graph to show, but basically it does expand to fill the time that you've given it to it. Is that the way you see it, Andy?
I agree. Yeah, I agree with that completely. Sometimes, now we're working in this PCN clinical director space. I sometimes find that the sorts of things people talk about doing or want to do, the sort of timescales feel really long for me sometimes, in terms of implementing a new service and so forth. And I sometimes try and inject a little bit of artificial time pressure, just sort of talk, just sort of, as you said, actually, if we tried to get something up and running, even if it's not perfect, within a month, let's try and start, or within 2 weeks, let's try and just start pushing through some patients through it, and that'll make us get things in place more quickly. Those sorts of things. So I think it's about the application of this law is really about using it to set sort of artificial, but to make sure you sort of set deadlines and get people working deadlines, get yourself working to deadlines, isn't it? I think that's
the key part. The way I use this a lot, and Andy probably knows this, is in meetings in particular. So whenever we have stuff that people want to bring to the meetings, that one of the first questions I always ask them is this for an update, is this for a decision, or is this for a discussion? And then with that, my next question is, how long do you anticipate this is going to take? I push people for a time frame, and if they come up with 2 minutes to come up for a discussion, well, then the reality is their perspective, what we're doing, is completely wrong, because you can't really have a discussion in 2 minutes, and vice versa. If you're giving an update that takes half an hour, again, you need to rethink that, because an update should not take half an hour. It should be 5 to 10 minutes at the most, depending on the complexity of it and things.
I've seen you do that, and that's really helpful in the meetings that you chair. I'll try and do it a little bit more myself.
And the other thing is, it gives a signpost to the other people in the meeting how long you're actually going to be spending on it. So once I get towards that end point, I'm like, well, we said we were going to give this 10 minutes. It's now pretty much coming up to 10 minutes. We need to be finishing it off, and it just helps, in my view, in terms of helping with that kind of concept and stuff. So making sure you're not wasting time.
Now, Gandhi, the dark side of Parkinson's law, I want to know what you think about this, is just leave something till the last minute. And then don't worry about it. Don't spend too long on it. Leave something till the last minute, and you get it done. And it's normally done with similar qualities. So if you spent a long time working on it, a lot of students either deliberately or inadvertently apply Parkinson's law in this way. What do you think about that?
Well, we do it all the time, don't we? How many times have you had something you've had to do, you left it to the last minute, and that's all of a sudden what sounded like it was going to take you forever, you did in an hour or a few minutes or something
like your tax return, Gandhi.
Like a tax return. Yeah, exactly. It always seems like an insurmountable thing that takes forever, but actually when you sit down and do it, it probably only takes you a couple of hours or so to properly do it.
I think careful application of this dark Parkinson's law can be helpful in some ways, but you have to be very, very careful what you apply it to. So the tax return, it's maybe a grey area, because there are consequences if you get that in late. But if there's things which where if it's not completed well or not completed, the consequences are small, not going to impact patient care, for example, then maybe consider applying that. But if something's important, then obviously you probably don't want to put yourself under that sort of pressure.
Absolutely.
That'd be very uncomfortable.
So my example of the really important thing that you shouldn't let Parkinson's law dictate how you're going to do it, the coroner's report.
I was just thinking the same thing, actually. And they often take a lot longer than you think. And they sometimes, when you actually get in the nitty-gritty of the notes, you actually find some unexpected things that require a lot more attention to pick through. So I was just thinking the exact same thing. And also the one I was thinking about was appraisal, because I'm sure that's where everybody applies. Many people apply the dark Parkinson's law.
But the coroner's report I'll come back to when we talk about one of the methods of figuring out importance versus urgency, which if people have heard me talk before, we'll know what that's going to be. But we'll get to that in a few minutes, shall we?
Let's go there now.
Before we do, Vij has come up with another kind of comment that relates to some of this, which is the one-touch technique. So once you do something, deal with it there and then, which is definitely a sensible approach. But it comes in play with the other things as well. So it's about that scheduling as well as impact and stuff and things related to what Andy's put up on the screen, which I'm going to show right now, which is the Eisenhower decision matrix, which I love.
Yeah, so you're a big fan. So talk us through this, Gandhi. Why should I be applying the Eisenhower matrix?
Right. So first of all, Eisenhower Matrix is by President Eisenhower, so former president of the United States. So he did some amazing stuff. But for me, the biggest thing he ever did was create this matrix. And it's basically a concept of ranking things in terms of importance versus urgency. And if you do that, you get these 4 boxes. Okay. So your important and urgent stuff is the do box, which basically means do it now. Your important and not urgent box is your decision box. You need to decide whether that's sensible to do. So probably better you schedule some time for doing that. Your not important but urgent box. Well, if it's not really important, do you really need to be doing it? In which case it needs to be done because it's got an element of urgency. So that could be delegated. Okay. And then the final box, which is the not urgent and it's not important. To be honest, you don't need to be doing it. So you need to find a way of getting rid of that particular task or thing out of what you need to do, because that's probably the thing that's slowing you down. And it's figuring out what you're doing and where they fit in these different boxes and stuff, and how you can then make your life so much more productive if you can do that.
Yeah, I agree. It's really powerful. And it's interesting how it sort of evolves with you over time as well, because I wasn't always in a position where I could delegate things, because we don't all have people that we can delegate to. But once you have, you kind of, you look at this graph and or this table and you see it in new light and you think, actually, yeah, things where you don't need direct control over the quality of it, but it does need doing, just delegate it, and then check it, absolutely. And you're not always have the freedom to say what you don't want to do as well, or what isn't important, and you just say no. I don't think we need to do that. But sometimes you reach a stage in your life when you do. So it's interesting how this kind of evolves with you over time. And that's something that I've found with the Eisenhower Matrix.
Absolutely. And what I recommend a lot of people consider doing is linking this with one of the other ones, which is the Pareto principle. Which,
that's Pomodoro. Pareto.
Yeah, we're jumping about a bit. Apologies for that. But the Pareto principle is the concept that basically, 20% of what you're doing will end up being 80% of your output. Okay. So if you think about whatever you're trying to do, work, home life, that kind of stuff, 20% of the effort that you're doing is actually going to lead to 80% of what the outcome is. So for example of that, there was a recent article that came out that said approximately 20% of the patient contacts actually results in 80% of practice workload. So there is good evidence about this in healthcare and other places. And I'm sure if you think about, the work that you do in practice, there will be a proportion of stuff that you're doing that actually makes up most of the outputs that you're doing. So, whether it could be complex patients that are having, most of the patient contact time within the practice. It could be pathology management, 20% of that kind of stuff is going to be what ends up being 80% of the workload from it. And the reason why I mentioned this is if you link this with the Eisenhower Matrix, if you sit down as a practice team and look at the different things that you're all doing and rank it up in terms of the Eisenhower Matrix, you'll probably find some of the key things that make up that 20%. And if you can then figure out how to improve that, the compound gains you get from that, because basically logic would state if you knock off 1% of that 20%, that's going to lead to a 4% improvement in terms of your productivity. Whereas to do the same with the other 80% of your workload, which is probably the easiest stuff to fix in some ways, actually the overall impact that has in your results is so much less, because you have to have a change of like 4 to 5%, I think, to make 1% change in that other category. I know I probably haven't explained that clearly. Apologies if I haven't, if I've confused people. But basically, looking at the graph, if you look at it on the picture that we've got, and apologies if you listen on the podcast, but if you knock off 1% of that red 20%, that's going to have an impact of 4% potentially in your output. And that's where you get your productivity improvement.
Yeah. I also think about this as a way of thinking about kind of where to apply your efforts. So, often at the end of a planning meeting, you've got a long list of things to do, but actually on that list, some of those things will be really high impact, and applying time to those will give outsized results. I think this is about kind of outsized results for effort. So something that we did that wasn't kind of essential was, a few years ago, we really looked at collecting our friends and family data via text message and things like that. And we put in effort in that. And then actually we've been loving that since then. That's had an outsized impact. So that's a really good principle. Pomodoro technique. We'll start whipping through these now.
Sure.
So
So Pomodoro technique is a simple basis on the fact that, if you're doing a task, you decide what the task is and you allot yourself 25 minutes to do that task. Okay. And you can do it in blocks of 25 if you want to. But then the key thing is you then have a 5-minute break. And the reason for that is simply put, the refresh that you get from doing a focused time on a project, quick break, and then doing some more focused time on a separate project ideally, or if it is a massive one where you have to do it lots of time, then fair enough, you can do that. But it is far more effective than just keep doing it. And the example I give to people is in general practice is your triage clinics. Okay, so different practices do different things, but in our practice we have a triage clinic for urgent on the day demand, and on a really busy day those clinics can be nearly 4 hours long potentially. And that's a lot of slog to get through. So what I insist on doing is whenever I'm in control of that, I will do focused 25 minutes of patient contact, and I will then make myself go have a quick 5-minute break. And the reason for that is that 5-minute break refreshes me so that my effectiveness and my productivity in terms of the way I deal with things gets boosted because I've had that quick little break, rather than just that constant decline of doing. And actually, it means I take a lot longer if I just keep trying to slog through it.
Yeah, no, that makes a lot of sense. I think I've seen a lot of kind of graphs that kind of look at some of the science behind this, and it's all about that. Attention and focus, decay with time. You can only sustain it for so long, but you can by just switching, doing something relaxing, and going back. You can kind of, your first burst gets you down to there, break, comes down, break,
exactly,
and you can actually get more focus out of yourself by deliberately scheduling those breaks. So that's really, really powerful. I think we talked about incremental gains already. So I think there were just a few, I think we've probably done incremental gains when we talked about habits, I guess. But there are a few just last ones I think you wanted to talk through, Gandhi, around 3 frogs and the 2-minute principle, which I think is similar to what Vij Kud has commented on as well.
Absolutely. So 3 frogs is a Mark Twain concept originally. It's written differently. I butcher it slightly, but I prefer my method. You've now been poisoned. You have to eat 3 frogs in order to survive. So my question to you is, which is going to be the frog that you eat the first?
Biggest. I know that's the answer.
Yeah. Biggest, fattest, ugliest one. Because once you've got that bad boy down, the rest are a lot easier to swallow in comparison to if you went the other way around. And it's no different with tasks. If you've got a big, heavy task that you need to do, then get it out the way, because otherwise it's going to be on your mind the whole day. It's going to slow you down. And more importantly, you don't want to do the rest of the day and then come to that big, heavy task last, because you're going to be tired, you're going to be drained, and it's going to take you a lot longer as a result of it. And again, my example from earlier,
live television, I have to deal with something. But if you want to talk about the 2-minute principle, I'll be back in a moment.
Fair enough. So my example again is going to be the coroner's report. Leaving that till the end of the day is probably one of the worst things you can do, because you're going to be tired, you're going to be exhausted, and actually it's going to make you feel really drained and stuff. And it'll probably take you a lot longer than if you just got on and done it at the start of the day and allocated some time to just get it done and more effectively. And then the 2-minute principle is probably what Vij was talking about, that one touch technique. And it's the concept that any task that you do, if it takes you less than 2 minutes to complete it, then complete it there and then. Don't delay it. Don't put it off. Pathology and letters is a great example for that in our workload. So, if you've got a letter or a pathology result that you can file, do it there and then. If it takes you less than 2 minutes to do the outcome from it, so if it's like one that requires a prescription, that should take you less than 2 minutes. Do it there and then. If it takes you longer than 2 minutes, they're the ones that you then schedule for a time later on. So either the end of your letters, once you've got through all of them, going back to those slightly more complicated and involved ones, or a separate part of your day where you're going to dedicate to your more complex admin or complex case stuff that you're doing, that is then, again, block booked in terms of what you're doing and stuff. So that's the 2-minute principle. It works with a lot of things. Emails is a great example. That's where it originally came from. The 2-minute principle is about how you manage your emails. But as I said, definitely applicable for pathology, for letters, and various other things in general practice.
So it takes less than 2 minutes to work out why your dog is whining at the back door. So there we go. Just do it there and then. One touch technique.
There we go. Those are basically the principles that we come across in terms of trying to, manage workload and time. And there are loads of other ones out there. As I said, there's loads of gurus out there that come up with loads of different other ways that you can do things. Tim Ferriss has his one, which is the 4-hour work week. There's various other ones. I've forgotten the name of the one I like. the morning routine one, which is the reason why I get up so early and do stuff in the morning before my kids wake up. I forgot what it's called.
Magic
now.
hour, something like that.
Something like that, yeah, possibly. I can't quite remember the name now.
Are you still doing that? Are you still keeping it up?
I wake up at 5 every day, pretty much. I do an hour's worth of work / other things in that 1 hour. So I break up that hour into 10-minute slots, and I spend 10 minutes doing prayers. I spend 10 minutes doing a bit of exercise, and I spend the rest of the time thinking about what I'm doing. So 10 minutes on a new project and 10 minutes on an old project. So yeah, that's what I do.
Do you find that is the prayer a bit like mindfulness for you? Because that's something
that's why I use it. The book talks about doing mindfulness, but for me, it's the prayer side of things. That's how I've adapted it for me. But yeah.
So I guess that's got us to the end of our list of things that we thought might be helpful. I know that as I sort of complete my review and planning going forwards, I'm going to be thinking about looking at things from that kind of values, priorities perspective initially, and then focusing down on goals, maybe think about composite goals, spreading those goals across times and across the areas that I've decided that I value, and then thinking about how I have the right habits and routines in place, and I'm applying useful and correct principles to my productivity going forwards. So I'm going to try and put much of that into practice. How about yourself?
Definitely. I think trying to figure out the priorities is probably something I'm keen at looking at for this year in particular, because the past few months have definitely changed my priorities in a lot of stuff I've been doing and not doing, importantly. So, what that's going to look like and what that's going to mean for me, my family, and basically everything else that we're doing together as well has been a big part of, the past few months has been a bit of a reality check, and then how that's going to change and stuff. So, yeah, figuring out my routines for work and life and stuff is definitely an important part of it and stuff. So, we'll let you know how that goes, because it's definitely going to mean some different stuff for us in terms of eGPlearning, isn't it, Andy?
Yeah, but so hopefully this discussion was helpful for people out there at this point in time where we look at the year ahead. Be interesting to know in comments and feedback, how people are preparing for 2022. If people have any principles or tactics that they're applying that they want to share with other people, that'd be really, really great to hear about. And thanks for people who've commented today on the live feed as well. Wishing you health and happiness and success in 2022.
And as always, let us know what you're thinking, and we'll catch you in the next episode. See you later.